explain us ergonomics in physiotherapy?
So, ergonomics essentially means optimizing your surroundings while doing any activity. So, which in return optimizes your performance in that surroundings. So, it usually people think that ergonomics is only restricted to workplace ergonomics, wherein like you're adjusting your workplace
Body
according to
postures and
to optimize your posture so that you don't cause mechanical strain for a longer period of time. But it's not only limited to that. If a sportsman is performing in his domain, he also has to follow certain ergonomic practices. So for a student, there are different ergonomic practices. So it is applicable for everyone, but what is the essential core of it is to optimize your performance and minimize the strain caused due to a faulty posture. So that is what it is.
So I could see a lot of corporates are also focusing on this ergonomics.
Yes, it is especially corporates have this focus that they want to reduce the absenteeism from work. So what happens is if there is the workplace ergonomics are wrong, so then the employees tend to take prolonged leaves because some or the other kind of pain and mechanical strain that is caused to them, which is going to be a chronic problem. So for that there are adjustable workstations. There is so the ergonomic chair, typical one would have a good backrest, back support, neck adjustments. So even the elbow has to be at an angle, so the shoulder has to be relaxed. The use of mouse pads really helps in the carpal tunnel. And the other things like whenever you're looking at your work, so your neck should be in a neutral position, your eyes should be looking downwards to your monitor. You adjust your monitor in such a way that you're not looking upwards, because when you look upwards your eyes tend to get dry much sooner. So what you can do is look downwards at your monitor at an angle, cervical spine in a neutral position, look downwards and take frequent breaks. Trying to look at a faraway object really helps. Every 15 to 20 minutes try to take a break. You can do simple ankle movement exercises, take a walk around the office, and you can also adjust your daily schedule in such a way that you alternate tasks. So if you're sitting in a place for like 20 minutes or so, then probably you can take a call in which you can be more active, walk around the office while taking the call and something like that. So basic small changes in your everyday practice can really help you avoid these long-term problems.
This is a very valuable information for people who have desk job. Can you share some tips for the parents that they can encourage their children to have some physical activities? Because nowadays we see like during childhood, a lot of kids are facing obesity.
Yes, childhood obesity is a big problem these days, and the lack of physical exercise is the primary cause, along with dietary changes. So, of course, dietary changes is something that we need to look into, very deep delve into. In terms of lifestyle changes, especially I feel for kids, we cannot like prescribe something to them without practicing it ourselves. So kids really mimic the behavior of their parents and the surroundings. So if we kind of inculcate then family activity on the weekends or even every day, making sure that they get at least good amount of physical play time, it is really important for them at their developing ages to let out that went up energy. They really need to run around, they need to jump around. That is very important. Outdoor play is very important for kids at this stage. It helps in their growth and their overall development. And in terms of curbing screen time, that is like there have been numerous studies and everyone is already aware of how many what are the repercussions of excessive screen time for kids. There is no replacement for physical one-on-one play for kids. There is no replacement for human connections. So what parents can do is inculcate. So these days parents are also very busy with their workplace and there is a lot of challenges. So instead of resorting to screen time, we can actively engage the kids even in household activities, household chores. Even that it can be very helpful, because we are engaging the child, we are making him feel valued and responsible, we are making them more independent. So there is no harm in adopting such practices. It also gives them a boost and enhances their self-worth. So that way they can stay engaged, stay creative, and even be more active in and around the house.
So how can parents identify that their children need physiotherapy treatment?
So one of the important things that parents need to observe is their developmental milestones of their child. So the milestone development has to be timely. The kid has to roll at a certain time, make eye contact, social milestones, motor milestones. All of these have to be achieved in a timely manner. If there are any deviations that are concerning, please get in touch with your pediatric or a physiotherapist. Also, there are a lot of therapies if there is any genetic disorder or any kind of malformation during birth or like any kind of gait disorders. The earlier intervention and earlier diagnosis really helps you along in the long term. So the recovery rate in early intervention is much higher than someone who is brought in at a later stage, because then it gets more painful and more difficult to reverse that. So this is what really helps, early intervention. If you notice any changes in the child's behavior or anything or any other medical event which may have caused his milestones to, any chest infection or any kind of other infection that the child has gone through, after which you look and you have observed certain changes in the child's behavior, then please get it into practitioner's note.
Also, are there any specific physiotherapy practices that are, beneficial to the expectant mothers?
So yes, expectant mothers, there is a whole branch of physiotherapy that deals with women's health. What they essentially do is prenatal care and postnatal care. Means that when the expectant mother is like a pregnant woman, usually due to the hormones, or like her ligaments are really lax. That means she's prone to injuries. Also, her spine curvature increases because of the weight that she's put on, and the center of gravity actually moves when a woman is pregnant. So what essentially happens is she usually complains of a lot of swelling, pain. So there is an entire protocol that deals with such women and what they have to follow, how to be active, what are the safe practices, what are the different exercises they can follow, and that really helps even during childbirth. So there is Kegel's exercises that is recommended for expectant mothers, and which helps even during the childbirth, like during the natural childbirth, and also post that to prevent urinary incontinence, other issues related to breastfeeding. All of these are addressed in women's health physiotherapy.
So we all have an elderly family member. So what are your tips for their lifestyle improvement?
Okay, so one of the most important things that happens as we age is that we start losing muscle mass, and the bone starts degenerating. The ligaments become lax, and the cushioning between your joints actually reduces, which causes more friction, more stiffness, and more pain. So essentially, your bone mineral density tends to peak in your late 20s to early 30s. Post that, every year it reduces by 0.5 to 1% because of various factors. Now it tends to increase more if you are if you have a more sedentary lifestyle and you don't have an active lifestyle. Plus, in women especially, during menopause and post-menopause, it actually reduces at a much faster rate compared to men. So now you can understand how our bones are becoming weaker by the day or by as we age. So for this, to maintain bone mineral density, it is important, of course, the nutritional factors we have to take care of. And the other aspect is strength training and a lot of exercises, a lot of, staying active and healthy. These kind of play a very important role. Otherwise, in the older age, you tend to have more, you're more susceptible to having fractures or easy fractures and injuries, which in older age again limits their mobility and could be a factor due to which they are confined to the bed. Some sort of balance training, adding balance training to them, encouraging to keep them active. So even if they join some social groups in which they look forward to venturing out every now and then, that is when they really maintain that lifestyle. And trust me, I think in India, people tend to adopt a more less active lifestyle much early on. In the West, people are, even at the older age, they are very active, they are very outgoing, and this is encouraged. There is no taboo around it. So I think that kind of thing has to be encouraged.
Preventive measures can really help the elderly group. Agree to it.
Yeah.